Kelly Mailer for Healthcare IT News. I'm here today with Cam Deemer of DrFirst. Thank you for being with us today, Cam.
Thank you very much. It's a pleasure to be here.
Can you talk about DrFirst's partnership with other EHR vendors?
Yeah, that's actually a big part of what DrFirst does these days. We originally started as a standalone e-prescribing company, but in 2004 realized it would make more sense to take our technology and break it down into its pieces, create platforms, technology platforms that other companies could build on. So we launched early on an e-prescribing platform and have been taking that out to the EHR community to help them get to market more quickly with a company that actually does this for a living and can handle all the complexities of e-prescribing. We currently have a little over 230 EHR partners that have built our technology in as their back-end e-prescribing system.
Can you talk about your guarantee that all physicians using our Copia MU will meet meaningful use requirements?
Yeah, that's an interesting question. In one sense, we can't guarantee that anybody will meet their requirements because they have to actually use the system correctly. But we do guarantee that the system is certified to meet all the requirements of meaningful use. So we normally would teach a practice how to build our Copia MU into their workflow, and just as a matter of the day-to-day work they do, they'll build up the information they need so when they attest, everything's there and they will meet the requirements.
Great. So Cam, what advice do you have for physicians who want to switch to paperless e-prescribing systems?
Paperless is a big step. A lot of practices have a hard time making that all in one big push. What we normally recommend to a physician is, if you're feeling uncomfortable with taking the step all the way to a paperless EMR, well, why don't you take the first step? Why don't you take the prescribing workflow, see if you can adapt your practice to electronic prescribing. It's a real minimum investment. And then take the next step, maybe move to our Copia MU solution, which is a modular EHR that meets all the requirements of meaningful use. You can actually collect your incentive monies, but at a very low cost. And then when you're comfortable, yes, we can do this, take the last step, go full paperless, ideally select one of our 200 and some partners, and all your data will transition, all the work you've done so far, and you'll be fully paperless. It's a very easy process, and you get your incentive money up front so you can make a good investment in the EMR that you really want instead of feeling forced to pick one up front.
What are some hurdles and barriers to paperless implementation for small physician practices?
Probably the biggest hurdle is really feeling like it's something they can do. There's a mystery about it. There's kind of the feeling that, this may work for other practices, but I don't know how I could ever adapt to this. I think talking to some other practices that have actually done it, as well as working with a company that's willing to take you a step at a time and not push you too fast. In terms of understanding how to do it in a way that's almost at no cost, working with somebody who understands the MU incentives, the meaningful use, and can actually teach you how to do that in a way that you don't blow all your budget right up front. I think those things are important steps for a small practice.
Great. Can you walk us through a typical implementation of a small physician practice?
Yeah, you're talking about for a meaningful use product. Yeah, this is really great. Probably the first thing we do, even during the sales process, is really help them cut through all the clutter around MU. They have to really understand it, and there's so much information it can be hard to decide what to actually look at and read. So we help them find something simple they can understand, help them understand the data they need to collect, and then we go out and we train them, first in the e-prescribing workflow, and then how to use the patient registry that's part of our Copia MU. And basically it's just when a patient comes in, you go through a series of very simple steps and all the information you need gets collected, and we just need to train them to do that. After we actually get them to where they can use it for a few days, we check whether they're collecting the information they need so they don't get blindsided later that they are not actually collecting what they need to attest. And as they get closer to a testing time, especially if they've picked up our Attest Easy service, we double check. We say, have you been collecting what you need all along? Are you really ready to attest? and then help them package it all up so they're sure they're going to get their money when they go through the attestation process.
Thank you.
Hopefully I didn't make it sound more complicated than it really is.
No, it totally makes sense. So a little current events question. How will the 2012 presidential election affect DrFirst and e-prescribing?
Boy, a lot of people have asked us that question. You know, we actually believe that technology has made so much progress now in the physician community. It's just going to keep moving on at this point. You know what? So in a sense, it doesn't matter who wins the election. You know, whether the Republicans win, whether the Democrats win. It's too late now to turn back the tide on technology. It's going to go.
Well, thank you for being here with us today, Cam.
Yeah, well, thank you very much. It was nice talking with you.
Thank you. This is Kelly Miller for Healthcare IT News with DrFirst.